Hi guys, Reproductive Health Network Kenya here again with Sex Games. Today we get to know those questions that you want to ask but you can't ask that revolve around sex, and if you don't get them right, get a balloon thrown at you. This balloon is full of water, so the sun is the best fit for it. For the first question, when do you have to use the emergency pill? Is it immediately after sex or any other time?
You can use emergency pill after sex, a period of between 72 hours. So that's the answer.
Correct.
The next question: which article of the Constitution provides for the right to the highest attainable standard of health?
43.
Yes.
The next question. This is a guy we want to. Can you get pregnant when you have sex on your periods? Not you, but if I have sex on my periods, can I get pregnant?
Probably is yes, because it usually depends with the day that the egg tend to break.
That is not true. That is.
It depends with the cycle of the lady. So if you have like a very short cycle and you ovulate closer, like soon after you have your menses, yes, you can get pregnant. But technically, you're not supposed to get pregnant because you've already ovulated and the uterine wall has already shed off.
So are you ready?
Yes.
So yesterday the High Court ruled out that yesterday the High Court ruled out that a man is ready to have to take care of the kid that's 9 years. According to that, do you think we are able to achieve gender equality through such rules?
I don't think we were able to achieve gender equality. I think we are at a milestone of achieving gender equality. Is it parental equality or gender equality? Are we considering the gender, the man and the woman? Because the case was against the man having a child, having custody of the child under 9 years. The ruling yesterday. I think it's a milestone, but it doesn't really make it equal, because in some situations, the man will still not get the child, despite the ruling.
How is it?
I can say she's perfect in it.
Maybe you can.
Definitely, as we champion for gender equality, having a man having custody for the kid at a younger age will champion for how do you call it, the parental cohesion between the child and the parents. Thank you.
Okay.
Lisa, how confident are you?
I'm scared.
How long do you think syphilis lasts in the body?
I do not know.
So, studies show that syphilis can last in someone's body for 10 years.
Wow!
Up to 10 years. Yeah, if you don't go, there's no way of testing for syphilis without going for actual tests. This is why it is important to not test your partner with your eyes. Go to the hospital and get them tested. Especially in men, some STIs remain asymptomatic in men, whereas in women the symptoms project. So if you don't get tested, you can never know if the guy is transmitting and retransmitting despite you getting treatment when you test positive.
Remember to get in touch in Neno Ability.
For more information. My question my question is on the 5 causes of maternal mortality. The 5 major causes of maternal mortality. 1,
Abortion. Unsafe abortion.
Two.
Relax. Poverty.
Can also contribute among Mogiwe Maji. So, the 5 major causes of maternal deaths, one is unsafe abortion, sepsis, obstructive labor, and then postpartum hemorrhage, and then we also have unsafe abortion. I don't know if I've repeated myself, but we have 5. Thank you.
After having unprotected sex,
Sure.
and you suspect your partner has HIV, how soon should you take PEP, post-exposure prophylaxis, and for how long should you take them?
2 in 1.
The PEP should be taken as soon as before 72 hours elapses, and they should be taken for 1 month.
Tumsamea, 1 month is just 28 days. Okay.
Yeah.
Yeah. It's correct. Lakini nasikia kumwagia maji.
My question is very easy. We are speaking about healthcare, but how does WHO define healthcare? Just mention the aspects of healthcare by WHO.
Oh, Jesus. It's not coming. It's not coming. Ngoja nipatie 10 seconds. Sasa una huruma.
1, 2, 3.
The 4 aspects of health as defined by WHO are first physical health, mental health, social health, and spiritual. So those are it touches on all aspects of healthcare.
You can't use latex condoms if you're allergic to. True or false?
Latex. I can't use them if
You're allergic to them.
there are people who are allergic to latex, but that doesn't mean you don't use a condom. So I don't know, but condom is
It was a yes or no question.
it was a true or false?
Yeah, it was a true or false question. That you can't use condoms if you're allergic to latex. What is the answer? Is this
False.
statement true?
It is false.
You can use other types of condoms if you're allergic to latex. That does not mean you should not use protection. Condoms are the safest way of having sex other than abstinence.
Yes.
Name 2 sex positions you cannot get pregnant in.
There's no sex position that you cannot get pregnant.
What?
Pulling out prevents pregnancy.
Does not prevent pregnancy.
That is false. Before umwagie nini, let us argue pia mimi nilikuwa na some discrepancies. Pulling out in some situations will prevent pregnancies that are not advisable, and also they transmit STIs. That was the answer. But why is your answer does not?
So the reason why I would say does not is because it is dependent on other factors. Some people might say it works because the calendar method. Could be it's because you are on safe day. Let's assume nothing happened. So could be because someone was on safe days, but really withdrawal method does not really, we would not encourage people to use that. It's not a reliable method of preventing pregnancy. We encourage people, if you are sexually active, ensure that you are on contraception, and there are different types of contraception. There's the condom, there's the injectables. We even have Cyanapros, which is the self-injectable, self-injectable contraception. Am I right as well?
You are right as well.
Thank you.
Withdrawal method requires a lot of experience. It's 75% accurate, but the 25% has 25% discrepancies. In that, if you are a newbie in the game, you might it might result to
Unintended pregnancy.
unintended pregnancy.
Na mtu akikwamilia, unajua someone might be
That's why
pulling
nimesema if you're
out
new-
and then you stick.
That's why we have the 25%.
45%.
It's true.
Okay,
Yeah.
okay.
To all of us.
This is to all of you. Whoever answers first and correctly does not get a balloon. The rest, me and the person who answers correctly will balloon them. So my question is,
Yes.
and you have 12 seconds to answer it. Let me put on my question voice. Guys, is it true you cannot get pregnant through pre-cum?
You can.
You can.
Explain.
I think there's like in terms of there could be some spams in the pre-cum.
What's your response?
Definitely you can get pregnant in the pre-cum because during the pre-cum there's a higher percentage of sperm content on the semen released. So definitely
You get pregnant. Msema ukweli.
Hey, hii answer yako imekuwa comprehensive.
Content.
Is it out of
Aya.
experience? I have a last question that I didn't ask it. I realized you. What is that?
Alarm.
So, my last question goes to all of you, and you will get balloons. Which year was Operation K started?
2010.
That's very good.
I have some-
Okay, thank you so much for watching today's video. We are hoping to have more of this in the coming months and days. I'm so paranoid. In the coming days, we are hoping to do more sex games and involve both people and discuss other frequently asked questions that you think cannot be asked, but we'll ask them for you.
And if you feel like an answer wasn't comprehensive enough or you doubt it, please reach out, call us on the number below, or follow us on TikTok.
And comment on our YouTube channel.
Yes, we will answer, we will respond, we will reach out.
Correct her attitude.
My attitude is perfect.
Okay, thank you guys. See you in the next video.
Bye.
Bye.